Okay, so this is episode number 7 of the Redefine Health Ed podcast. I'm your host, Dr. Katie O'Bright, and tonight I have an excellent guest, Dr. Ari Ginsberg, who is a physical therapist slash psychologist extraordinaire. So, Ari, thanks so much for being on the show. And go ahead and just introduce yourself. We really haven't had that much of an opportunity to talk, so I'm looking forward to this conversation.
All right, well, thanks for introducing me. Again, my name is Ari Ginsberg. I'm a PT. I got my doctorate of physical therapy in 2010. So I've been practicing now for about 11 years, but I've always been fascinated with psychology, and I've always read about psychology. And with the help of my wife motivating me, I decided to go back to school, and I started a master's program. I completed it in industrial organizational psychology, which is basically the psychology of business. It's all about how to apply psychology in a very practical manner in order for organizations and businesses to achieve their goals, to achieve success. That's a little bit about me.
Incredibly important and incredibly useful and pragmatic. I might actually be picking your brain on certain things.
No
So
problem.
tell me, like, it is very atypical, at least in my experience, it's very atypical for somebody with a DPT or any like kind of advanced professional degree to go back and decide to kind of do something else. So what was your decision making for obtaining this degree, and why did you decide to do it, and what are you doing with it now?
So great question. So my motivation is based on my passions. I mean, growing up, even in high school, I used to read Freud, and even later on, I would read about behaviorism. So I've always been fascinated with psychology, but I never really wanted to be a clinical psychologist. I don't know if I have the patience for that. It just wasn't something that I wanted to do, but I wanted to figure out a way to integrate my passion, my enjoyment of psychology, and understanding how people think, which is really what I'm fascinated by, how people think, what patterns of thought are, and how to integrate it into being a PT, because I do enjoy being a PT. I love treating patients and helping patients in a physical way, but I also think adding in the psychological component is really key in order for our patients to achieve outcomes and achieve success. And that's really why I went back to school. And I had a lot of the knowledge from just reading books, but my wife was the one who said, you should really get a master's degree because it'll give you some recognition, it'll differentiate you. So I went back to school to get the master's, but I've always had in the back of my mind this desire to share with my colleagues some insight into this area. And I love teaching. I was a teacher, a high school teacher, for 1 year prior to being a PT. And it was a disaster. Yeah, it was a really bad experience. One of my webinars on burnout, I show a picture of a person with a blanket over their head. And that was me every single day. I would come home and I was just exhausted. And I knew that teaching high school wasn't what I wanted to do, but I knew that I still wanted to teach. And to me, teaching adults, teaching colleagues, professionals is really amazing because I don't have to deal with discipline, thankfully, which is the biggest issue in teaching high school. And typically most people are respectful that you meet. So it's a lot better environment. It's way more conducive for sharing insights and ideas. And I've been teaching on and off for many, many years. And that's why I just decided to explore my passions. It was time for me to move forward and to challenge myself with a new experience. And this is how I did it.
That's awesome and so incredibly applicable to our profession right now, especially. So I mean, I've said this pretty much in every episode that I'm in my clinical fellowship, and one of the course that I'm taking right now is all on pain science. And I can't tell you, like, we're on week 4 right now, and almost everything that we've been talking about has been psychologically based. Like, we're really talking heavy about how the nervous system works and how emotions and stress and the endocrine system affect the nervous system. And I mean, it's really profound. And I think that any healthcare provider, but especially in PT, where we meet so often with our patients, and so much of what we do has to do with how we can motivate the patient or how we can get a sense for where they're at in their head. I mean, that is like all the rage right now, I think, in the research and just in the way that people are teaching and learning. So You are teaching a course for us next Monday already. Oh my gosh, it's already next Monday.
Yeah, next Monday.
So Monday, June 14th, from 8 to 9 p.m. Eastern Standard Time. Come join us. We already have a couple people registered, and it's going to be a great course. It's only an hour. Who can't spare an hour? And
Exactly.
I'm kind of curious to hear about why it's called the New World of Rehab, addressing burnout, which, again, talking about hot topics, is a humongously hot topic and very relevant to most of everybody's lives, especially coming out of COVID. So why did you decide to talk specifically about that area, and what interests you there?
Okay. So with the new world of rehab, I think that rehab has evolved tremendously, not necessarily in a positive way when it comes to work productivity demands. So if you think back to the past, or if you know any PTs in the past, the way they describe it, and anyone in healthcare, is that they had as much time as they wanted to with regard to their patients. They made a lot more money. And one of the things that I speak about in my webinar is that there's research that demonstrates that despite the fact that we're going to school longer and we have greater expertise as rehab professionals, the pay is really flat. And that's really something that's terrible. And it's dramatically increasing the burnout rate amongst our profession, and that and productivity demands. And also, I try to use my own experiences and reference them in the webinar. So some of the things I speak about are the emotions of treating patients and how you deal with those emotions, which also can affect burnout. Like if you have, for example, I treat the elderly population. I'm a home health physical therapist. So if you have a patient with cancer, and it's just particularly depressing, sometimes you don't realize the toll it takes on your mind and the toll it takes on you emotionally. And it's another contributor to burnout in the profession. So with all that together, with the productivity, and nowadays with COVID, that was also another huge, I know I speak about this in my webinar. I don't want to give away the whole webinar because I want you to attend. But one of the things that I speak about is how in the beginning of COVID, especially, I was so afraid of being the cause of somebody else's death. And that was a real fear that I had. And I had a patient who actually passed away from COVID. I'd had actually several patients that passed away. And I remember hearing about one patient in particular, and I was so shaken and I was so nervous that it was me, that I was the cause, and I was asymptomatic. And I remember getting tested, and thankfully it wasn't. But just thinking about that and being afraid of being the cause of somebody else's death was just such a cause and a feeling of exhaustion. It created this feeling of perhaps burnout. And that was one of the reasons why I wanted to speak about this topic. And also it just fits into the general themes of psychology and understanding, what things affect your mind and what things affect you in the profession. So I want to help people. I want to share insights into maybe some unique causes, some strategies to deal with burnout, and some signs. And that's pretty much how I break it down. There are 3 parts to the webinar. The first part, I go through some of the causes, and I know people think they know what the causes of burnout are, but some of the causes I mentioned in the webinar are more subtle. They're more emotionally based, or they're things that I don't think everybody always thinks about necessarily. So I had feedback from one of my webinars, and the person said, I didn't even realize that the cause of my symptoms was really burnout. So I like to hear that. I like to hear that I'm sharing insight and showing people that perhaps what you're feeling really is exhaustion tied to burnout. And then I speak about some common signs, like you might be more irritable and not know that that's really a sign of burnout. For example, that's just one example. And then finally, I go through some psychological techniques, like I speak about cognitive behavioral theory, which is one of my favorite techniques. But I speak about how whenever you think something in the extreme, this is an example of cognitive behavioral theory. So even in a relationship with a spouse, if you were to say, you always do that, or you never do that, whenever you think in an extreme way, you have to challenge those thoughts, because most of the time, I would say 99% of the time, people aren't just good or bad. They're usually mixed, and there's usually some inaccuracy in that method of thinking. But when you give into it, and when you start thinking you're always like this, you never say thank you, then you go down a slippery slope. And what ends up happening over time is that your thoughts affect your emotions, which affect your behaviors. So the key to cognitive behavioral theory is to analyze your thoughts about the profession, for example, and see where your extremes are. When you say, oh, every time I treat a patient, it's this, or my company always does this. When you start thinking in those in those terms, in that framework, that's really negative, and that could cause really harmful effects. in terms of burnout. So those are some of the things that I speak about.
I think, wow, like so much can be said now. So I think that just to share like a personal note, yesterday I kind of did a Q&A session. I was previously, not currently, but a cash-based practice owner, but basically during the height of COVID. And I taught a class to Oklahoma City University on just kind of did a Q&A session on like how I did that and what I'm doing now with Redefined Health Education. And one of the things that I shared with them was, as a business owner, like I am not, just because I'm an entrepreneur business owner does not exclude me from any of this that you're talking about. I have constant ups and downs and highs and lows. And one of the things that has really gotten me through all of that is working with a therapist and working on being more aware of these thoughts as they come into my head, and being aware that these thoughts may or may not actually be the case. So that self-reflection has helped me make this happen. And I don't think that if I didn't have that part of my life, and if I didn't have an awesome supportive husband and, you know, supportive family around me, that I would be able to do this. And I think that that's important. I'm saying this because I think it's important for people to hear that nobody is excluded from this or from feeling this way. Or
so I just wanted to, I mean, I appreciate what you just said. And also, I mean, I am included. I've been in therapy in the past, so I just want to be open about that. And I think therapy is just a really valuable tool to what you said, understanding yourself, being aware of your emotions. Self-awareness is really key. And without it, you don't need, so in my webinar, I don't speak about the need. You don't need to have a therapist, but it's definitely beneficial. But you need somebody that you can just vent to. You need somebody that you trust, that you can be open and honest with. And usually, sometimes it's a spouse, sometimes it's a friend, it could be a therapist, but you really need somebody in your life that you can share some of your emotions, your raw emotions with, in order to get past that, in order to move forward and actually progress in your life and grow as an individual. So I definitely agree with you. And, you know, I think it's really important that you mentioned that. Definitely.
Yeah, absolutely. And I also think like some people are not talkers per se. I know when I'm really upset about something, I'm a talker just in general. Most of the time, I'm an open book. But when I'm really upset about something, I actually tend to shut off. And what I do is I journal. Like or even on my phone, I have like this notes thing, like a private secret little notes thing on my phone. And I just jot my thoughts down so that I can reflect and so that I can actually type them out and then reread them, just to check my own thoughts. And I would encourage people to do that, because a lot, like you said, most of the time our thoughts, when they get negative and then when they go into this rabbit hole of gnarliness, what you're creating in your brain is not what's actually happening. And that is what sends you down spirals of like crazy behavior. And I hate to I shouldn't use the word crazy, but I'm talking really about myself.
But I mean, you're 100% accurate in that sense, that what happens is that you end up falling into these traps in your mind. And if you're not aware of the traps and the triggers, then you end up going down this slippery slope, and it gets worse and worse and worse. So just an awareness of the self, which is something I also speak about in the webinar, about self-awareness theory, and really, you know, talking it out and really being as reflective as possible, and also being honest about your strengths and weaknesses. And in doing so, that's really another way that you can be more realistic about your expectations. Because let's say, for example, you have this fantasy, you know, that you're going to make $1 million a year, right? For example, fantasy. And we all have that fantasy. But the question is are you setting yourself up for failure by giving, you want to work towards a dream and you want to be motivated, but don't set yourself up for failure. Don't give yourself a fantasy that's torturing you, that's really causing you more pain than good. So you have to really balance it out with choosing to have something that really motivates you to continue to grow, especially as a business owner. Like, I'm also a business owner, but you don't want to create a fantasy that's really torturing you, that's really unrealistic, and is really making you depressed or unhappy. So you have to balance it. It's a really important, you know, balancing act that you have to do. But it's really, again, I really think it's integral. Yeah.
That is awesome. And I'm coming back to like another thing that has come up a lot in pain science, like individuals with chronic pain and individuals with an extensive amount of disability. I'm curious, especially in home health, like you were talking about cancer, and I had a year experience at OU's Cancer Center and loved the experience. I actually interviewed Elise Cantu last night, who's the onco PT, and we talked about the emotional toll that it can take on you as a, you know, as a full-time oncology PT. So I'm curious, in home health, like what are some of the strategies, two questions. What are some of the strategies that you do with yourself to help, you know, reduce those feelings of the, you know, those feelings of, you know, if you have like a kind of a depressing case that you're working with? So that's my first question. My second question is, what are some like psychological strategies that you use in your clinical practice to help kind of see where a patient's at and learn how to motivate them? So go from there.
So no, I mean, yeah, I have a couple webinars on those topics, so I'm just going to talk about them, but great question. Thank you. I appreciate it.
I should actually say ahead of time. So Ari's business is Psychology for the Body. It's psychologyforthebody.com. So go ahead and visit his website. But yes, Ari, please feel free to talk about your other webinars that you have.
So yeah, let me just, so in terms of dealing with my own emotions, again, it's what you mentioned before. I have a support system in place, my wife, my family, people that I could talk to at the end of the day, where I can say, you know, this is really bothering me, or I can't believe this happened. And these things affect me, but because I have a support system, you also, you know, a therapist, these are the best ways for me personally to deal with some of these issues. But in terms of the patient itself, I mean, that's where I have a webinar. It's called, I have two webinars on the similar topic. One is called The Science of Bedside Manner and Patient Satisfaction. And the other one is just a 1-hour version. It's a little bit different, but it's called Optimizing the Patient Experience. But in both of those webinars, I speak about empathy and how you can improve your empathy. So I talk about strategies from the literature, like, for example, reading books about people who've been ill in the past, especially healthcare clinicians, is something that can make you more empathetic, because we as clinicians identify with those practitioners. And because we identify, when we see our patients, we can see them with a different perspective, with a different light. Or another way that I speak about improving empathy is just through communication. It's not about necessarily how you feel inside, but it's about what you're conveying to your patients. How do you convey empathy? So you want to ask them about their emotions. You want to mention to them, you know, you want to explore their emotions. Can you explain to me what you're feeling? So these are some of the strategies I use. And I love this topic, which is one of my specialties, called social psychology, which I don't know if many therapists are familiar with, but it's really the study of how little things can influence people. For example, just in this podcast, you know, the color of my glasses, or the color of my eyes, or just my shirt color, the tone of my voice, the confidence that I'm exuding. So if I was a different looking person and I was saying the same thing, but I was stuttering, how would that affect the way that I convey information to you? Mm-hmm. And if you understand, you know, how people think, and what we call them in social psychology, they're called heuristics and biases, that people have certain impressions of you early on. If you understand how those impressions are made and the normal thought patterns of your patients, then you can really be an optimal clinician. You can really, you know, optimize again, and you can be an excellent in terms of bedside manner. And one of the goals of that webinar is to show that it's a skill, that if you understand psychology and you understand how to convey empathy, what people perceive when you're using certain terms, for example, or when you're mirroring another person, or when you understand biases and you schedule and I go through all these different biases, but you schedule your visit in a certain way. So all these things matter in terms of the effect that you have on your patients and on patient satisfaction. Mm-hmm. And it's not just about patient satisfaction, it's also about patient outcomes, because patients who are satisfied are more likely to follow through with their plan of care. They're going to follow their home exercise programs. So that's why I really think it's important to understand. That's one of the areas that I specialize in and I love and I'm passionate about, is understanding the psychology of connecting with patients and understanding how to use the tools and treat it like it's a clinical skill. And that's what I try to convey in my webinars, that you want to treat bedside manner skills the same way as you would clinical skills. And just like we're constantly trying to improve on our manual techniques, you should constantly be trying to improve on your bedside manner techniques as well. So I go through some of those techniques in the webinar. So I recommend it. It's a great
You,
webinar.
and you should. It's, I mean, so well, I want to come back to one of the things that you said, which is reading. So reading about other people's experiences. And the very first thing that came to my mind was When Breath Becomes Air. Have you
So, so
heard this?
believe it or not, that is the book that I mentioned in my webinar. So that was the book. It's from 2016, and I mentioned it in my webinar. It's a great book. I read it many years ago, and it's a Pulitzer Prize, I think, finalist. It was really good writing and really excellent, depressing, but also poignant because it speaks to us as clinicians. So yeah, that's the actual book that I recommend. So,
I definitely would recommend that because it was written by a physician.
he's
I
a
can't remember special, was he?
he was a neurosurgeon.
Surgeon.
Paul, I think his name is Paul Kalanithi. Yeah.
Yeah, yes, you're 100% correct. So When Breath Becomes Air, and he developed cancer. And actually he was writing the book and he passed before he ended up finishing the book. So there's um oh my gosh, is the epilogue the one that follows?
Yeah. Yes.
Epilogue. So there's an epilogue written by a family member, I believe.
Yeah.
But man, like, talk about, yeah. So that wow, cool. We're on the same page. Awesome.
Yeah, we like the same books. So yeah, so that's one of the things that I recommend is like reading or like I said, active listening skills. I speak about humility, respect. I speak about all these different, and I like to use research to support everything that I'm saying. So I try to find as much research and literature that I guess complement and also support some of the ideas that I am expressing in the webinars. So that's
So
my goal.
another thing, I'll tell another little story that happened yesterday. Apparently, this is just a really good day for us to be talking. So yesterday, I had a dentist appointment. First
Okay.
time since beginning of COVID, or even before COVID. So I was like going there, and I was like, oh my god, everything's going to be totally wrong. And I'm in a new city. And this I ended up finding this dentist as a recommendation through a friend. And then I find out it's like 35 minutes away. And there's like some trafficy areas in between. So as I'm like mapping it out and driving there, I'm like, all right, this is just going to be a one-time visit and I got to find something closer. But as soon as I got there, this dentist like blew my mind. He did the most thorough dental exam I've ever had in my entire life. He was so detail oriented. He was an excellent communicator. And I was like, he's going to take care of me and he's going to take care of my family. So like, I am okay with this whole idea of traveling, 30 minutes away to see you because I know that you're going to do an awesome job. So, and it wasn't just, I would not have been able to tell that he was like an excellent dentist by just what he was doing and how long he was spending in my oral cavity. But just the fact that he was explaining exactly what he was doing. He showed every little thing on my radiographs to me. And just the way that he communicated was like made me feel so much more confident in him. And I think so that's just such a great point about how our communication skills and our body language and the way that we express ourselves is so important in the whole patient experience. That does it certainly contributes to outcomes. It has to.
Yeah, definitely. I mean, I have a great example that I use from one of these books called The Upside of Irrationality. So if you ever get a chance, it's by Dan Ariely. I don't know if you've ever heard of him, but he's an amazing writer, and he's
Rationality.
The Upside of Irrationality, and he writes another book that I love. It's called Predictably Irrational. Really good books. Excellent. So he was a professor. He is a professor at Duke, but he was also in MIT. And he's a double PhD. He's really, really brilliant, but also a very humble person and a great writer. So in one of he speaks about different experiments that he puts on with some of his friends in college and MIT when he was a professor, some of his students, his graduate students. So one of them that's amazing is he has a graduate student, the experimenter, go up to people in a coffee shop and give them a menial task. So this experimenter would say to an individual at the coffee shop, here's a piece of paper with a bunch of letters. If you circle all the F's, for example, on the page, I'll give you $5. So after the person circles it, the experimenter comes back and gives them $6 or $7. It doesn't give them the exact amount. And what they're studying is how honest people are and how likely they are to return the extra money that was given to them.
Mhm.
But the second part of the experiment, the same experimenter goes up to different people and he's explaining the directions, but in the meantime, he gets a phone call and he picks up his phone and he pretends like it's a pizza store calling him, puts his phone back, and then continues and says, if you fill out and you circle all the F's on the paper, I'll give you $5. And the same thing, they would give him $6 or $7. And they found that those individuals who weren't disrupted by the phone call were way more likely to be honest and to return the extra dollar or two than the people who are distracted and disrupted with your phone call. So it shows you just the fact that if you distract yourself for a moment from your patients, for example, with a phone call, a text, which is really hard for us now that we live in the technological age, but it shows you the power of distraction in terms of body language vis-a-vis your patients and vis-a-vis people. They get so upset that you might not even notice it, but unconsciously they want to keep the money. They want to be dishonest towards you. They want to take revenge on you. So that's one of the
Don't care as much to be honest in that relationship.
yeah. So if you want to be again, so that's one of the ideas that I speak about in my webinar, which is the importance of using your body language and not being distracted and focusing with your eyes and your body and again your body and your facial expressiveness. You don't have to be smiling all the time,
Mhm.
but you want to express yourself. You just don't want to be monotone. And if you're distracted, if you're thinking about something else, your patients will pick up on it and it'll really undermine the confidence they have in you.
So this is again another story recently. So I had shoulder surgery. Everybody knows this. Like I'm almost 3 months out. I had an anterior stabilization, so I still need a lot of work. Like I was in an immobilizer for a long time, so I'm like still very weak and have limited mobility. So I was going to PT, and the PT that I had in Pittsburgh became a very good friend of mine. She spent a lot of time with me one-on-one. And her clinic setting actually was or the company was like, they wanted her to see more patients an hour, but she was just like, no, I don't want to. I need to do this in order for me to be happy and in order for my patients to do well. So she spent a lot of time with me one-on-one, and I developed an awesome relationship with her. I come out here and I had my first PT appointment, and I can't tell you the number of times that I was interrupted. And I really, and I'm a PT, and it was just kind of like there was just so many distractions going on. So even though I think like
Well, that's one of the benefits of home health. That one of the benefits of home health is that you get that one-on-one time, and you're really in the patient's house where there's really, you can really focus, and there's not as many distractions when you're with the patient. So that is definitely a benefit of working in a person's home as opposed to being in a clinic where there's other people there for sure.
Oh, and like, how much does this say? I've always had this issue with orthopedic settings, is that a lot of times, sometimes you don't even have a private room to do an evaluation or to really talk one-on-one with somebody. Sometimes you're just kind of out in an open gym. Like after I had another procedure done, I had a PT evaluation, and it was just out in an open gym, and I wanted to talk about something personal, and there was like another patient on the table next to me. And
Yes.
I just wonder, from an orthopedic perspective, how is this going to get better? Because it can't continue this way where we keep just like punching volume forward in these crazy open gym settings, because this stuff that we're talking about, the communication factor and the therapeutic alliance and building that relationship and building the experience, it really matters. And I just can't see it getting any better from here. Do you have any comment on that?
I mean, I think more PTs have to stand up and just say, I'm not going to do this. And we need a lobby. We need a lobby, government in order to get the proper reimbursement rates, because it's not right. It's not fair. We go to school for, 3 years, get our doctorates. We're really experts in this field. But again, if you look at the research, the pay really hasn't increased relative to the debt that we're taking on going to school. And it doesn't make any sense at all. So we really need to fight, I think, the system as a whole. And also you yourself, you need to set up your practice the way you want it, and I know it's easier said than done. And trust me, I know that, but it's difficult, but I think it's worth it in the end. And in terms of dealing with your company, that's another webinar. So I know I'm plugging my webinars a lot, but I do have a webinar on leadership where I speak about how it's called, there's an assessment called the DISC assessment. I don't know if you ever heard of it, but the
I heard
DISC
that.
assessment, it discusses 4 different personality types. The D stands for dominant, and it's the way in which you address challenges. Influence are people who like to talk and tell stories a lot and like to be kind of in the center of attention. Greens are like steady people, and the steady is the S in DISC. And then finally, there's compliant. There are people who are very perfectionists, but also are like rule followers. And most people are a mixture of these colors, but they each have their own communication style. And if you want to be a successful leader, you have to learn how to communicate within another style. So if you want to get things done in your organization, if you're a PT and you want to make a point to your managers, to your leaders, really understanding personality types and the way in which others communicate in your organization will help you get things done. So that would be another suggestion that I would make, which is understand how to communicate from somebody else's perspective. Because if a manager is coming to you and they have upper management who's breathing down their neck, at least see it from their perspective too, as the PT, understand where they're coming from, but also learn how to communicate within their style of leadership, within their style and their personality type. And if you do that, I'm not guaranteeing success, but you're more likely to get things done in your organization, in your company. So that's something else that I recommend, understanding communication styles of different personality types.
That's amazing. And this is bleeding over so well into all of the recent talks that I've had, not only with the one last night that I had with Elise, but last week I interviewed the Mikes. So the doctors Mike O'Hara and Mike Steimling are teaching the Paying It Forward, Why, What, and How to mentoring students and young clinicians on June 19th. We did a podcast episode that just came out, and a lot of the stuff we talked about was, there's this, we know how to, or at least we should know how to communicate with our patients and be able to assess where they're at and be able to, motivate them and communicate with them and educate them. So how do we take those strategies and just bleed them over into our ability to communicate with a student or a mentee, and then same thing with leadership, like if I'm an employee, being able to communicate with my manager or my employer, and then vice versa. So like all of these topics, I feel like they
tied to one another.
Yeah, they're very much tied to each other, and
Definitely.
they have a lot of overlap. The skill that is developed for one can be applied to most, if not all. Would you agree?
Definitely. Yeah, 100%. And also in terms of motivation, I mean, again, I do speak about motivation for home exercise programs in another webinar. And basically the best way, and I'll talk about it briefly, but in psychology, there's something called internal motivators and external motivators. And internal motivators is when you love something for itself. Like I love road cycling, I love biking, and I don't race or anything like that. I go out on my own and I just love it. I just love the experience. I love everything about it. But if I were racing in a race like the Tour de France, then that would be an external motivator. There'd be a part of me that was motivated to win the race as opposed to just enjoy the experience. And psychology has constantly shown that internal motivators are stronger and more powerful than external motivators. So your job, I think, as a PT, especially with certain types of patients who are skittish, who you suspect aren't really confident in doing their home exercise programs, is figuring out what really motivates your patients the most. And the only way to do that is to develop relationships with your patients. But once you understand what motivates them the most, you can use that as a tool to push them in order for them to follow their home exercise programs and really give it their all in PT. So that's really, I think, the key to motivation. I mean, I also speak about other theories of motivation, and I speak about social psychology in the context of home exercise programs. But overall, if you can figure out what another person is really passionate about, and you can use that as a tool to motivate. And the only way, again, that you can do that is by understanding how to connect with your patient and understanding how to speak to them and really have them open up to you. And I know that it sounds like our jobs are, we're not therapists, we're not psychologists, but we need to use psychology and our knowledge of psychology in order to get our patients to open up to us a little bit and find out what motivates them. So like if you have a patient, for example, who loves golf and all they do is talk about golf, so there, that that's their prime motivator. So you use that when you talk about your home exercise program, you talk about how it'll help them get back on the course and it'll help them improve their swing. you just want to focus your motivational strategy and persuasion on the very internal motivator that is most powerful amongst your patients.
Well said. Well said. I mean, I have been really enjoying this conversation. I can't even tell you how much overlap it has had with a lot of the other conversations that I've had recently, both on the podcast and off, and everything that I'm learning in fellowship right now too. So much of what we do as PTs has to do with psychology. So
yeah, and also, I mean, I just wanted to add, one of the books that I use, which is another book that I recommend, is called The Psychology of Persuasion. It's by Robert Cialdini.
Yeah.
You've read it?
No, I've not read it, but I've heard of it. And I'm sure that my husband had to do something with that in his MBA program. They had to do a negotiations class. And I'm pretty sure he had to read. I'm going to ask him afterwards. I've heard of this.
So the thing is, I take his book, Cialdini's book, and what I do is they're really strategies for marketing and negotiations. But I try to take those ideas and the concepts of negotiations in business and apply it to negotiating with your patient to do their home exercise program. So I speak about some of the tools that he uses. Like he uses a tool called concession, that when you show that you're willing to give in to somebody else, they're more likely to follow through on your request. So when you're designing your home exercise program, first design it harsher, a little bit worse than you're planning to give it to the patient, and then have them choose the exercises and then show them that you're willing to give in a little bit, that you're willing to concede. Because as a negotiation as a negotiation ploy, and this works in anything, in selling your home, for example. So when you concede, you're more likely to get follow through. So that's another aspect of one of the webinars that I give on home exercise programs, and how you can use things that apply to marketing, but if you extract all the psychology behind it, you can actually apply it to rehab. And it's a really fantastic way to motivate your patients. So that's one of the things that I speak about also.
That's great. And so negotiate. I'm pretty sure he had to read that for him.
Like I speak about it in my web, he speaks about charities. He does a lot of experiments with charity. So one of the interesting things, I'll give you an experiment that he speaks about that I remember off the top of my head, and I talk about in my webinar, that once, let's take the Hare Krishna group. I don't know if you know of them, but they used to ask for money in airports. They would go around raising money for their religious group in airports. And they weren't successful in the beginning, but then they tried a new tactic. What they did was they would give out a flower to each person that walked by and then ask them for money. So what they found was that they were a lot more successful when they gave out the flower than when they didn't. But it's not because the flower is expensive, but there's a concept in negotiation called reciprocation. That if somebody gives you something, you feel like you owe it to them to give back to them. So you could do the same thing with motivating your patients with home exercise program. Understand how reciprocation works. Maybe give them, a company pen while you're giving them the home exercise programs. And even if they're not conscious of the fact that you're giving them something, but unconsciously, it might have a powerful effect, and they might have a desire to return the favor. You gave me a pen, or you gave me a mug, or you gave me something from your clinic. And this is why people use marketing, marketing swag in order to get patients to be motivated. So you can use something as simple as that, and unconsciously it could have a really more powerful effect than you can even imagine. So that's another thing that I recommend in my webinar.
And this whole situation of reciprocation also ties pretty darn well into parenting. And the very first thing that popped into my head, now most people would call this bribery, and I think it's more reciprocation. So I'm thinking, my boys are 3 and 4, they're both potty trained, but when we were potty training them, we would say, if you go pee on the potty or whatever, we'll give you an M&M. So we would give them one M&M or one little gummy bear or something. And that worked 100 times better than if we were just go.
Yeah, for sure. I mean, just using rewards like that is definitely a powerful motivator. I mean, I know with my kids also, same thing. So I've gone through the potty training stages as well. And I try to use a lot of these principles in parenting. And try not to be a robot about it. You can have all this knowledge, but if you're not natural and you don't come off as natural, your kids will see through it, and your patients will see through it too. So if this isn't part of who you are, if you don't integrate it into your personality, again, you won't be successful. But yeah, these are very valuable tools in terms of parenting and helping raise your children. So yeah. So I try to share these insights with my wife as well. So we both are on the same page.
It's everywhere, all
Oh
relationships.
yeah, yeah. I mean, psychology, that's one of my, psychology is really applicable in all these factors and all these facets of life and your work, whether it doesn't matter what you do, whether you're a businessman, like, your husband, whether you're in marketing, whether you're a PT, a doctor, dentist, like you said. I have a friend who's a dentist as well, a really good friend of mine, and he's an endodontist and he's just starting his practice, but he has an amazing personality. And he did a root canal on me, thankfully, and I got a nice discount doing that. So that was good. But he's very thorough and he's an amazing personality. And in the past, I've been to another dentist who did the same thing and just not as personable.
Yeah.
And my friend, I just told him, like, he just has everything that it takes to build a successful practice. And that's really what patients are looking for. They're not just looking for their teeth feeling better. They're looking for somebody who's comforting to them, who's thorough, who explains things. And he happens to be an amazing dentist, in terms of his skill set, but I wouldn't know that. I'm not a dentist. So it's like you said, my brother said that. My brother's a dentist as well. And I know I have a lot of dentists, but my brother's a dentist and he he tells me all the time, like, nobody knows how good I am in terms of my
Exactly.
skill set. The only reason why they choose me is because of my personality, because of my bedside manner, because I'm able to communicate and connect with my patients. So yeah, it's very applicable in all areas of life.
Definitely.
And also for my own, just to add one more thing, I mean, one of the reasons why I'm so passionate about the topic of bedside manner and patient satisfaction in particular, but I also, again, I mentioned the other webinars that I give, is because I myself, I mean, I use some of these strategies. I'm not the most extroverted person. I'm actually an introvert by nature, but I realized after doing my job and wanting to be an excellent therapist, I realized what I was doing that was working, what wasn't working. I was studying other people and I realized that even if you're not the most extroverted person and you're more of an introvert or you're a quiet person, you can still be an amazing communicator. You can still build these connections. It's not necessarily, it doesn't have to be ingrained in you and born in you, but anybody can learn how to do this and anybody can take these skills and really use them in their practice in order to build relationships and connections.
I'm really glad that you said that last piece because I feel like sometimes people they'll say things like, that's just not me. That's just not who I am. That's just not for me. But I do think there is definitely a component where of all of this where it can be learned. It's not just innate. And
Right.
there's always refinement. It doesn't matter if you're an introvert or an extrovert or anything, you kind of learn how to communicate better and what strategies are effective in your relationship and what's not. I've definitely learned what's not effective over time. And it's just like anything else. Your skill set with with your hands, with your exam skills, with your general knowledge, all of that, it changes over time. And so does your ability to communicate. And man, this is just so incredibly important.
Definitely. And also it helps when you have, in relationships, if you have a spouse that will explain to you or talk and explain to you what they're thinking.
Yes.
Because I know that's a common source of frustration in marriages and couples and stuff, where there's an expectation, you should know what I'm thinking. A lot of people think that way, but if you have somebody that you can ask, like a spouse or significant other that you can ask, what are you feeling? What are you thinking? And they could be honest with you. It just creates like a much stronger bond, a much stronger relationship.
I can
So I
attest to
think,
that in
yeah.
my marriage as well. It's because we force ourselves to, even if I'm like reluctantly communicating when I'm upset, at least I'm communicating and sharing what's going on and trying not to just be passive aggressive and like hold things inside. And
Yeah.
that all leads to no good.
100%. Yeah,
Yeah.
100%. Definitely. Yeah, so that's my take on on psychology. It's such a valuable tool. And again, it really applies to all areas of life.
Absolutely. So Ari, thank you so much for joining me tonight. If people want to contact you, how can they find you?
So I have my website, which is psychologyforthebody.com, but I also have, that one redirects to psychologyforthebodyceu.com. They're both the same website. So either one works. And I have you can call me, my phone number's on there. So feel free to call me. My email address is ari.ginsberg@psychologyforthebody.com. So you can certainly email me And also you can check out some of my webinars on my website. I have both live webinars and also on-demand webinars. And again, I'm excited to do this webinar with Redefine Health coming up this Monday night, 8 o'clock. I'm going to be speaking about the topic of burnout and how it's really important and essential for us in rehab to understand the causes, the signs, and how to deal with burnout. And I specifically take literature that applies to us as rehab clinicians. So it's not just this broad webinar applied to everybody, but I specify it to rehab clinicians. And being of a rehab clinician myself and somebody who has experienced burnout in the past, I can really share my own experiences, and hopefully you'll gain insight and gain knowledge and progress as a PT and a rehab clinician, as an individual. So that's my goal.
It's going to be awesome. So don't miss it. Go and register www.redefinehealthed.com, and definitely go over to Ari's website, psychologyforthebody.com, and check out the other stuff that he has there. So pretty much that's a wrap, and we'll see you hopefully Monday night.